CAPE, for those of you who don't know us, CAPE's been around for about 25 years. We are directed by a board that has 10 physicians on it from 4 different provinces and one of the Northern Territories. And I think that's probably all I need to say right now. We are a donor-based organization, and we primarily do a lot of research, education, and advocacy on environmental issues, and we're particularly focused on climate change these days. So just to get a sense of who's on the phone right now, we thought we'd do this poll and just get a sense from, how many of you are actually public health students and whether or not we have a mixed audience. So just waiting here for a minute from people. Okay, well that's kind of interesting. Okay, and then the next one, it looks like we've got a kind of quite a few public health students, but also some other kind of guests outside of the public health sector. And so now just getting a sense from people about where you're from geographically. And I don't think I can see the results here. Okay, it looks like we've got a lot of people from Ontario. And okay, that's great. Okay, so moving on. So the call to action on climate change and health, it was kind of an action taken by several organizations. CAPE worked with the Canadian Public Health Association. We worked with the Canadian Medical Association. The Canadian Nurses Association, which is a professional association that has about 140,000, represents 140,000 registered nurses and nurse practitioners across the country, and also with the Urban Public Health Network, which is an organization, it's a small organization of medical officers of health from across the country who have responsibility for urban centers, large urban centers in Canada, and they're responsible for about 50% of the Canadians. So they have responsibility for the public health of 50% of the population of the country. The other thing I'd like to just note here on this slide is that the call to action can be downloaded at the link that's provided on this page. And I just want to point out throughout this presentation, I haven't included references because most of the information is drawn directly from our call to action, and all the references are at the back of that report. So if you want to see any of the references from this PowerPoint, just go into the call to action. So why did we do this? There were kind of a few different reasons, but one of them was because of the summer that we had last year. So last year we had tens of thousands of Canadians who had their lives, their jobs, and their homes threatened by wildfires, extreme heat, power outages, tornadoes, and floods. Also, we do know from the literature that we know that the health of Canadians is already being impacted, both the mental health and the physical health, by climate change. We've seen some health literature has actually kind of demonstrated that in some situations, cardiorespiratory impacts are happening from exposure to smoke from wildfires. We know that in some situations, people are experiencing trauma and post-traumatic stress disorder from emergency evacuations and displacement from extreme weather events. We see in the Arctic there's some evidence that Indigenous communities are having their access to traditional foods decrease because they can't access it because of thinning ice or because of melting permafrost. We also know that Lyme disease is spreading into new regions in the country and that the number of cases is increasing. And we know that extreme weather events have been increasing in frequency and intensity over the last 2 decades at least. And just as one little indicator of that, government spending on extreme weather, like the damage from extreme weather events, has increased from about $100 million a year 2 decades ago to $2 billion a year in the, most recently. So that's just one little indicator, but we do know that these things are increasing. So last summer, we kind of had a summer, I think there's been lots of extreme weather events and wildfires that have been impacts of climate change, and I think people have kind of recognized it as such. But last summer we kind of had a summer where all of Canada seemed to be impacted by climate change in some way or the other. In central and eastern Canada, for example, we had an extraordinary number of high heat days. So for example, in Toronto, we had 21 days where the temperatures exceeded 30 degrees. Now that's to be compared against the 30-year average that ended in 2005, where in Toronto we'd have 12.2 days per year. And it's exactly what's expected in terms of modeling if you look at the figure to the right, which has been provided by the Climate Atlas. It's also kind of when I looked at the number of days that were above 30 in other cities, in Winnipeg and Montreal, the same kind of trend was demonstrated. And in the one province of the country that actually reports premature deaths from extreme heat in real time, Quebec, they did actually report that 90 additional deaths happened in 1 week because of extreme heat in July of last year. So at the same time, central and eastern Canada was kind of dealing with this extremely hot summer. In the west and kind of still some of central Canada, there was all kinds of activity in terms of wildfires and then people being impacted by smoke. So I was hearing from some of our physician members in BC, in Vancouver, I had one physician say that he had even kind of young adults coming in saying, you know, should I be riding my bike this time of year? In other places, we had people saying that the air, you could actually see the smoke in the air for days and weeks on end. And so what we actually had going on there were thousands of people were evacuated from their homes. Thousands of people were on notice. So there was all kinds of mental stress in terms of people worried about what's happening with their lives, their homes, their jobs, their school. At the same time, millions were exposed to air pollution that was rated as very high risk or high risk for days or weeks on end. So the Air Quality Health Index actually was at 8 and 10 and 10 plus in Calgary, Vancouver, and Edmonton last year for days or weeks at a time because of smoke from the wildfires. So this is kind of the first time I think where we had such an extensive exposure of Canadians across the country at the same time, kind of being exposed in some way to a climate-related exposure. So the other kind of event that kind of spurred us on to kind of draft the call to action was the release of the 2018 Lancet Countdown Report. So the Lancet is a prestigious medical journal that's been around for many years, and in 2017 they started putting out a special annual report called the Lancet Countdown on Health and Climate Change. And what they've done is they look at 196 countries. They have data from 196 countries, and they've got 41 indicators of climate change. Some of those are health indicators, some are policy indicators, some are mitigation indicators, but they look at these 41 indicators for these 196 countries and then they put out a report. So the second one came out in November of 2018, and here were just a few of the indicators of kind of what they had to report. They reported that in 2017, 712 extreme weather events occurred around the world, resulting in $326 billion in economic losses. This was a threefold increase over 2015. So that was one of the kind of the indicators that they provided. Another one is that they reported that 3.4 billion weeks of work were lost in 2017 because of extreme heat. Most of those were in the agricultural sector. So this is kind of days where it was actually just too hot for people to be out in the field working because the temperature was so high. It was just be dangerous for people to be out in the field. And another indicator was that 30 different countries that provided data, all of them indicated, kind of reflected that agricultural yield potential was decreasing because of the high temperatures. So these are all really worrisome kind of indicators. And the conclusion that was drawn in 2018 by the Lancet Countdown was that trends in climate change impacts, exposures, and vulnerabilities demonstrate an unacceptably high level of risk for the current and future health of populations across the world. So that was their conclusion. And they also concluded that the number one health impact from climate change in the 21st century will be undernutrition. It'll be food shortages. So the third event that happened in the fall of 2018 was that the International Panel on Climate Change released its report in which it compared the impacts of a world with 1.5 degree of global warming to a world with 2 degrees of global warming. And so just to put this in context, right now the average, we're standing right now at 1 degree of global warming. That's right now the world is on average 1 degree warmer than it was in pre-industrial times, and that is a global average. So places like the Arctic, it's much higher. It's actually might be as high as 3 degrees higher in the Arctic, but on a global basis, it's 1 degree right now. And this report was looking at what would be the impact around the world, 1.5 and 2 degrees of warming. It was 800-page report, and it concluded, and this is a very conservative report. It's negotiated, the language is negotiated by many different countries, and they concluded that 1.5 degree would amplify all of the effects that we're experiencing now. They would all be that much worse, but that 2 degree would be so much greater for ecological systems and human health. Now, it's hard to kind of talk about this because it's all kind of in comparison language, and there are many different indicators looked at. So they were looking at things like biodiversity, they were looking at sea levels, they were looking at the number of people who would be exposed to flooding from rising sea levels. They were looking at the impact on fish and aquaculture, on agricultural crops, so many different indicators, and they're all kind of looking at them with kind of, the degree of certainty and also how they compare, and it's all kind of in comparative language. But just one indicator that I think kind of helps to put it in some kind of little glimpse of their findings is that they found that with 2 degrees of warming, several hundred million more people would be exposed to climate-related risks and susceptible to poverty by 2050 than would be with 1.5 degrees of warming. So what they describe when you look at it all, it's actually a very bleak future. They're talking about, most of the coral around the world being destroyed with 2 degrees. We're talking about, food shortages. We're talking about refugees on the move because they can't get food or water from their countries. And so it's quite a bleak picture, and it's a very disturbing picture. So we kind of look at the Paris Agreement. So this is why the 1.5 and 2 is so important. In 2015, when the Paris Agreement on climate change was struck, this is an agreement that 195 countries have now signed on to, including Canada. Under that agreement, there was a commitment made to hold global warming well below 2 degrees and to pursue efforts to limit global warming to 1.5 degrees. So this is why this International Panel on Climate Change report has come out. It was kind of a response to that. And I think at the time at the Paris Agreement, and I wasn't at the meetings, but my understanding from talking to different people is that they kind of went in aiming for 2, but some people were saying it has to be 1.5 because the science is telling us that it really needs to be lower than we're aiming for. And so I think this is where this report has come out. But if you look at the modeling, the figure on the right there, you can see that the predictions or the projections are that at the current rates of warming right now that we will be at 1.5 degrees within 11 years. And that the current trajectories for the world at the current levels of emissions of greenhouse gases, that we're on course for 2.6 to 4.8 degrees of warming by 2100. So we're talking about a world that would not be habitable by humans if we were to get to those levels of warming. So there's a great deal of urgency. And to prevent 2 degrees of warming, the International Panel on Climate Change concluded that collectively and on a global basis, we have to cut climate emissions by 45% by 2030 and to 0 by 2050. So this is to keep global warming from kind of going up to 2 degrees of warming. And just to point out there, so we have 11 years to reduce emissions by 45%. So just to kind of go back and look at it from a Canadian perspective, where are we? So after the Canada made its commitment to the Paris Agreement. We committed to reducing greenhouse gases by 30% of 2005 levels by 2030. Now, this is actually an old target that was brought forward. I think there were many people who feel that it was not adequate to meet the commitment that was made. But even looking at that target and where we're at, if you look again at the figure on the right, what we're seeing is that Canada is not really on track to meet even that commitment. So the Auditor General for Canada actually reported in 2018 that right now we're not we're kind of over 100 megatons above our 2020 target and where we should be for 2020. So right now we are not on track to meet that target, and we know that that target wasn't ambitious enough to begin with, and now we know that we need to do much more in order to limit global warming to 1.5 degrees. So just a few more pieces here on Canada. One of the things that we see in the media a lot is people, you see that people saying, oh, well, Canada's only responsible for, less than 2% of greenhouse gases on a worldwide basis. We're not one of the big players. And it's just not really true. We are not one of the 2 or 3 biggest players, but we are absolutely one of the 12 biggest players. There's 5 different years here presented over the last 30 years, and Canada is in the top 12 for all those years. And so Canada this is on an absolute basis. This isn't per person. This is our absolute emissions. We are one of the biggest emitters in the world. So absolutely, it's up to us as well as others. And many would say that, like many other developed countries, that Canada has to do, even more than other countries because we have contributed so much and because we are a wealthy country. So the other indicator in terms of Canada's emissions is a per capita. This is how much we emit on a per person basis. And once again, we are among the top emitters in the world in terms of a per person emissions. Now, this does reflect to some extent our individual emissions in terms of, from individuals are driving or the heating of our homes, but it also reflects our industries and our production of fossil fuels, etc. So those emissions of our industries, etc., are reflected in this per person emission rate. So we look at Canada's greenhouse gas emissions, and I'm afraid that that chart's not coming out very clear, which is unfortunate. Sorry about that. So when you look at this, the top one, the blue one, that's kind of moving up on the right-hand side is for the oil and gas sector. Right now, the oil and gas sector, so this is the production of the production and refining of oil and gas, natural gas. Right now, it's responsible for 26% of all of Canada's greenhouse gases. And what's distressing is that has been on a climb for the last 20 years or so and continues to be climbing into the future. So that's very worrisome. The transportation sector is the other high bar there, and it's the brown one, and it's responsible for 1/4 of our emissions. And that's been climbing and for the last 20 years. And it's a sector that we think should be coming down, but it probably needs to come down a lot faster than it's kind of the trajectory is planned right now. The good news story here is the red bar, which might not be too easy to see right now, but that red bar is that's come down quite a bit over the last 20 years. That is the electricity sector, and it's come down because of the phase out of coal-fired power plants in Ontario. That's largely why that's happened. And the downward curve towards 2030 is because Alberta and then the rest of, and then the federal government has passed regulations to phase out coal-fired power plants across the country by 2030. And just one good note on this point is that Alberta, which 17% of the greenhouse gases in Alberta several years ago were actually from their coal-fired power plants. And the percentage of coal-fired electricity has dropped by 22% last year, and that was partially because of the carbon pricing scheme that they have in Alberta, was kind of encouraging people to the industry to kind of move away from coal, and it's already kind of moving, kind of reducing emissions from that sector in Alberta. So here's the good news. The good news is that many of the things that we have to do to fight climate change, the climate solutions will actually produce immediate and significant health co-benefits for Canadians. So in the when the Lancet Countdown report came out in November of 2018, there was a policy brief prepared for Canada, and in that policy brief, it was estimated that chronic exposure to fine particulate matter, that's one of the major components of air pollution in Canada. Chronic exposure to fine particulate matter from burning of fossil fuels is responsible for about 7,100 premature deaths per year, and those were valued at about $53.5 billion per year in health-related costs. And if we can reduce fossil fuel burning, which will absolutely reduce greenhouse gases, then we will actually be reducing air pollution that are causing these premature deaths and these health impacts. And so one of the ways that we can do that is by investing in public transit and cycling, by shifting from gas-fueled vehicles to electric vehicles, by ensuring that our communities have compact urban design that support public transit, walking, and cycling, by shifting our energy away from things like coal and natural gas towards renewable energy, by increasing the energy efficiency of our homes and of our businesses and of our industry, and by reducing our extraction of oil and natural gas. So all of those things will do both. They'll produce air pollution health-related health benefits directly for Canadians in the jurisdictions that are taking actions, while also reducing Canada's emissions of greenhouse gases. Secondly, we also know that chronic diseases cost Canada about $200 billion per year in treatment and lost time. That's an estimate that comes from the Public Health Agency of Canada. And so we know that physical activity is one of the, or physical inactivity is one of the factors that contributes largely to chronic disease. And so again, by investing in public transit, in cycling, walking, and compact urban form, we can increase physical activity among Canadians. We can reduce rates of cardiovascular disease and premature deaths and healthcare costs, and at the same time, we'd be reducing greenhouse gases. So this is one of those, I call it the kind of quadruple win, because it's got all these wonderful benefits, but it also, when we make investments in public transit and in cycling and walking, we also increase social equity, and we increase access to jobs and recreational services, etc., for all of our people. So it's a really, this is something that would have many benefits from a health perspective, social benefits, as well as climate benefits. And then again, speaking about chronic diseases, another factor that really contributes to chronic disease in Canada are rates of obesity. And we know that if we can promote diets that are rich in plant-based proteins, that we can reduce rates of obesity, we can reduce rates of heart disease, diabetes, some cancers, and healthcare costs, while reducing greenhouse gases. So again, this is one of those things where there's kind of a win-win. And the new Canada Food Guide, it does encourage people to eat less meat and to get more of their protein from plant-based proteins, and to eat more fruits and vegetables. And so that would be very good for human health, but it will also be good from the perspective of climate change. So the other good news is that Canadians actually care about climate change. So when we look at a number of polls that have been done, 70% of Canadians believe that human activity is responsible for climate change. We could probably improve that a little bit. 90% of Canadians believe that it is harming their health. And that's important because we know that people are more likely to make behavioral changes if they feel like the activity is harmful to their health or the health of their families. And almost 90% of Canadians are willing to change their behavior to help fight climate change. So all of these are really good indicators, and I think what we need to do then is have the policies and programs and funding situations that help encourage people to do the right things and to take the right actions. So the call to action on climate change and health, what we were trying to do then, or what we're going to continue to do, is we were calling on each federal political party to make meaningful and effective action on climate change a central theme in their party's platforms this year as they prepare for the federal election. We were saying that we would like to see every party commit to have Canada do its fair share to keep global warming below 1.5 degrees. and that they should all be coming up, and they should be, if they're competing, it should be competing to have the most effective and comprehensive climate action plan. We would like to see them all come forward with like a whole slew of policies and programs and demonstrate to us how they are going to, how Canada, if they're in charge, how Canada will do its share to meet this incredibly urgent goal that's going to be incredibly challenging. We also had, now in our recommendations, we had a number of subsets to this, and we had some that were directed at each of the sectors that were important, like oil and gas and transportation. We also had a recommendation about just transition policies, and we also had some recommendations that were directed at climate change adaptation, things that were necessary to protect Canadians from the climate change that is already happening and that will continue to happen. So what have we done to date? So on, right now, what we've done on this issue, sorry about that, hang on. So what we've done today is we released the call to action on February 5th, and we did this at the Press Gallery in Parliament Hill, and we had a press release, and we were trying to attract some media attention, and all 5 of the organizations mentioned at the very beginning, the CMA, the CPHA, the Canadian Nurses Association, the Urban Public Health Network, and CAPE, we all participated. And then we met with leaders from each of the parties. We met with the leader of the Green Party. We met with the Minister of Environment and her staff. We met with the Chief of Staff for the Minister of Health, and we talked to him about the call to action, our recommendations. We also met with the Environment Critic for the NDP. We did request a meeting with the Environment Critic for the Conservative Party, but he declined a meeting with us, which is really unfortunate. And then we followed up by sending our call to action and our letters to all of them, and sent letters to all of the political parties. And what we were trying to do was kind of set the stage for them, saying, this is an issue of broad interest to Canadians. This is not an environmental issue. This is a health issue. It's a health issue that's of concern to many large, to the large national health organizations across the country, but also to many Canadians across the country. And so what we did get an op-ed published. We did get a few media hits from that action, and then we've been really promoting our call to action through social media. And the plan for us over the next several months is to do more of the same. We want to continue to meet with members of Parliament to talk to the different parties. We want to try to get more op-eds out there, letters to the editor, try to keep the issue in the kind of the public sphere, so that the public is thinking about it and really recognizing how incredibly crucial this specific issue is to the federal election that is coming up at the end of the near the end of the year. So in terms of what others can do, what we've been kind of saying to our CAPE members, and we'd say to others of you, is we've now put the call to action up on our website, and we've now made it so that people can sign on and endorse the call to action. And once we get a number of signatures, we would send that in to each of the leaders of each of the 4 federal political parties. We've been encouraging our own members, and we'd encourage any of you, call your member of Parliament. You don't need to be an expert to call a member of Parliament or send them an email and tell them how worried you are. They don't really care about the expertise that people have on these issues. They care about how many people care about them. And if they feel that their constituents are really worried, then that's the kind of thing that will motivate them. So we think it's really important that lots of people will be sending emails and meeting with their members of Parliament if you feel confident enough to do that. We would also suggest that you might send them the call to action that we've prepared and say, I see this and I'm really worried and I support the 1.5 goal. That's how I'll be voting when it comes to the next election. The other thing we can do is right now, kind of inspired by Greta Thunberg, kids across Canada are now starting to organize, or students are starting to organize around school day strikes. Fridays for Future Canada is, so now there are kind of demonstrations are being organized by students. We would encourage people to participate in these or support them. Support them through social media by spreading the word or just expressing your support. At CAPE, we put out a press release, and 2 of our members wrote op-eds for papers. So just kind of letting people know that we think that that's really important. We understand why these kids, this is their future we're talking about. So, just participate in the demonstrations if you feel comfortable doing that. The other thing that's extremely important is to vote in the federal election. So we have 11 years to reduce global emissions by 45% to prevent catastrophic levels of climate change. That means that in this election, we are electing the people who will determine whether or not Canada does its part to help prevent um, this from happening, and whether or not they will make clear and strong targets, whether they will set up a program that helps us to achieve those targets. And so probably from a climate change perspective, there's never been a more important federal election. And so we've just really encouraged, I think, particularly for those of you who are kind of younger adults, I think as a generation, the older generation tends to have better kind of turnout rates for voting. It's really important that young people get out and vote. And I know sometimes I have two kids in their 20s and one in their 30s, and I think sometimes that it can be easy to be a little cynical about political processes, and these things do matter. Even if we can't count on them entirely to fix the things that we worry about, they do matter because these people will have incredible influence over public policy and the direction that Canada goes on this issue. And then the other thing that I would say to all of you is everybody can get involved in local issues. So we need climate action at every level of government. We need climate change adaptation programs in our communities. We need healthcare facilities to mitigate their greenhouse gases and to adapt and prepare for climate change so they can respond when there's an extreme weather event or when there's an increase in insect-borne diseases. We also need programs at every level. So, we need cycling, we need compact urban form. All of these things can be worked on, and health arguments can be born on each one of these. We can bring healthcare argument or health evidence and health arguments to all of these different tables, and they do have sway. We have seen this ourselves. At CAPE, we were very involved in the Alberta discussion for several years around the coal phase-out, and we kept kind of the messaging about the air pollution health benefits for Albertans. We kept that in the public sphere. We kept saying that in the press. We did it with op-eds. We did it with ads in transit stations. And so by bringing some of those health evidence kind of forward, it can kind of help educate the public. It can bring decision makers on side, and it can help to shift policy. And so that all of us can be involved in all these different ways in different communities across the country. We need these policies to happen at every different level of government across the country. And so to kind of support this at CAPE, we've actually we're just finishing it off right now. We were very fortunate in January. We secured some funding from the Climate Action Fund provided by Environment Canada. We have produced a climate change toolkit for health professionals. It includes 8 modules, and it'll be produced in English and in French, and we hope to release it later in April. And it will have a module on the health impacts of climate change across Canada. It'll have one module that just talks about emission trends and the contribution of different sectors for each province and territory across the country. There's a whole module that's dedicated to the health co-benefits that are associated with different climate solutions, so that people could kind of look in there to see what kind of health arguments they could bear for various policy discussions that are going on. We have one that's dedicated to addressing climate change in healthcare institutions, both from a mitigation and an adaptation perspective. And there's a module that's dedicated to preparing for climate change in our communities that talks very much about climate change adaptation, the things that we need to do to minimize health impacts from the climate change that is actually occurring in our communities. And then there's one about how health professionals can get involved, and there's one about the global health impacts, and then there's one just about the climate science and international agreements and where we're at with those. So that will be coming out, and we prepared this intentionally so that people could use it to educate their peers and to use it as a tool in their workplace, or to use it as an advocacy tool in their own communities or healthcare facilities. Oops. Oh, sorry. And that's it for me. Thank you very much.
Thank you very much, Kim. What a great presentation and a lot of information in a very short period of time. So we have a few minutes for your questions, so please post them in the chat box. I've noted a couple of the comments that have been shared, and certainly this isn't just a federal issue. Provinces and territories have to be engaged in this discussion as well. And I certainly encourage all of you to contact your provincial territorial public health associations if you want to be engaged in more advocacy work around this. There are provincial elections currently, there one in Alberta. There is upcoming ones in Newfoundland and Prince Edward Island. And I think that's it for provincial elections this year. So certainly these issues can be addressed. One of the things that CPHA is doing is we're working with the Canadian Coalition for Public Health in the 21st Century to put together what we're calling an elections playbook, but it's a toolkit as well for on a series of different topics, including climate change, that if you're engaging your local candidates at all candidates meeting or writing a letter to the editor, it just gives you some background information and helps you pose some questions that hopefully will get these politicians to state where they actually stand on these issues. There's another component about communications and engagement that is certainly a huge part of the call to action. And there was a question about what are the top challenges, and I'll turn it back to Kim for her thoughts. But I know that one of the key things I can say to you is every time you hear greenhouse pollution pricing being referred to as a carbon tax, correct the person and say it's a price on pollution. Because this is the highly partisan game that's being played with this issue. You may not agree 100% with the federal government's current plan, but as far as carbon pricing goes and pollution pricing goes, it is at least a step in the right direction. So the one thing everyone can do is don't let someone else call it a carbon tax. Kim, did you have any thoughts about some of the key challenges you've experienced when it comes to communicating about climate change and how you address those challenges?
Well, I think one of the big challenges is sometimes just getting media attention. I mean, as for, February 5th, we did this big press event. We put out a press release. We had these 5 organizations, 3 of whom are very large or very influential organizations, and we still got relatively little press. So that continues to be a problem, is how to kind of find a hook to make this newsworthy. That tends to be a problem. I think the other thing we're all struggling with is, on the one hand, we want people to understand how incredibly urgent this is and how incredibly terrifying some of the reports and the results are. At the same time, we don't want people to be so terrified they curl up in a ball and go into denial mode, which we understand that people will do. So I think it's trying to figure out how to give enough information that's kind of urges people to act at the same time that we give them hopeful suggestions and information and encourage them to act and to empower them. So I think it's finding that balance that we don't kind of telling people what they can do that will have a positive impact. So I think that's a really tough thing right now.
Great. Thanks, Kim. So shout out to Carlos for scooping me on the notice that the Canadian Journal of Public Health has released a call for papers on moving to IPCC 1.5 degrees Celsius, exploring promising public health research, policy, and practice responses to environmental crisis in a warming world. So the deadline for that call for papers is August 1st. So take a look at that at journal.cpha.ca. Kim, 2 questions for you. The first one's easy. Where will the module, the toolkit, be available once it's launched? And then the second question is, what do you think are some of the key areas you feel could use some more research evidence?
So the first question, our module will be putting it up on our website. We'll have one page dedicated, like the modules have all been designed that they can stand alone, but they're complementary. So we'll be putting the toolkit up with each of the modules, and each of the modules has a fact sheet that goes along with it. So those will all be posted on one web page in English and another web page in French. And we will be announcing that in February and kind of putting it out on social media and that. So, if you're following CAPE at all on Twitter or Facebook, you would be aware of that. And then in terms of the research, I mean, certainly I know that I think many of us feel there's not enough research being done on the mental health impacts of climate change. And I think just there's all these different terms that have been going around, but I think part of it is like about the trauma of people who are going through extreme weather events, but there's also kind of the chronic kind of mental health impacts for among our children and people who are really worried. I work with young people who are telling me they're not sure they want to have kids because they're so scared about the future. So I mean, what are we doing to people when we feel like this issue is, how is it impacting them mentally? And then also for those, particularly I think among Indigenous communities who are very grounded in the land and whose way of life and culture and food and everything is attached to the land when the land is changing so much. So I think those mental health impacts probably require more research.
Great, thanks, Kim. Catherine's asking, how do you perceive the role of regional public health units across Canada? Would they be interesting partners and a strong voice across Canada to mobilize the healthcare sector, local population, and different levels of government?
Oh, absolutely. Now, I come from Ontario, and I worked for the public health sector in Ontario, so I'm a little used to, I worked for public health units that were more embedded with the municipalities. Rather than regionally, but absolutely, I think there's an incredible role for public health here. I think that we really need to educate people just generally about the fact that there are health impacts. It is surprising that sometimes people are not aware of that. I think people have become aware of it in the last year, but the other thing is also on the co-benefits, I think, are incredibly powerful to bring the health arguments and the climate kind of solutions together. I think it's really powerful, and I think that it can kind of make for some really nice collaboration, but I think public health has an incredibly strong role, and also around things like climate change adaptation at a community level, in terms of helping those tables to get going at the community level. What can communities do to prepare for extreme weather events, and how do they protect their population? I think there's a very important role for regional public health units or public health authorities.
Excellent. Thanks, Kim. A few more people are typing questions, so I'll just mention that the call to action is being modified and only slightly to fit our format, but CPHA is developing a position statement on climate change and health, and all of the calls to action that you see in this document are being included as recommendations. So the first draft of that is going to our Public Policy Committee for review next week. And depending on their feedback, we may be fast tracking that so that we can have a position statement out in time for the federal election. So keep your eyes peeled for that one coming up as well. Beverly writes, collaboration is key. Is CAPE working with renewable energy companies and organizations, resilient city networks, so that all these other groups emphasize the health benefits of ramping up major initiatives in the next 11 years?
So one of the challenges I've had since I've joined CAPE is when I joined CAPE, there were 2.5 staff, 2 staff and 1 contracted position. Now we have 4.5 staff, and 2.5 of those people kind of support us. They're the digital communications person, fundraising, financial. So part of the dilemma for me at CAPE has been there's a huge demand for our work, and only a few staff to do all the work. So what we've been doing across at CAPE is over the last several years, we've had a lot of people coming to us, doctors, medical students, public health professionals, saying we want to be involved. We feel like we need to do something on climate change. And so we've been trying to figure out how to harness that. So there's kind of 2 things that we've done. One is that we've set up regional committees in 4 provinces now, BC, Alberta, Ontario, and Quebec. And those regional committees are chaired by a board member at CAPE, and they now have between 20 and 50 members on them, and those people are all everything from public health researchers, public health officials, doctors, medical students, etc. And they're kind of doing they're kind of picking a few issues to work on, and they're kind of collaborating together. For example, next week there's 5 workshops happening in BC around the impacts of fracking or hydraulic fracturing in northeastern BC, and that's all been organized by our BC Regional Committee. And so there's lots of activity going on. So the idea of those committees is to kind of allow our membership to be kind of more active and to kind of do some more of this work. But the other purpose of our toolkit, our intention here is, if we can continue to get some more funding, is to use our toolkit to actually do workshops and kind of train the trainer. And our hope is to kind of help kind of educate, build capacity among our members and other health professionals so they can kind of go out in the world and do all the things that Beverly was mentioning.
Great, thanks, Kim. Now, Richard asked, can you suggest some especially helpful resources that summarize the most effective economic and policy options to effectively deal with climate change? I'll jump in first and say, as we just posted on the site, CPHA collaborated with CMA this year, and we did it ourselves in 2017, developing the Lancet
That's right.
Policy brief for Canada. So it's a policy briefing for Canadians. And there's some really good recommendations in there. We worked with Dr. Courtney Howard, who is a strong member of CAPE. Is she still the president, Kim?
Yes, she is, yeah.
Okay, president of CAPE, and on both of those reports. So if you look at those together, there's, I think, a total of 13 or 14 recommendations that are really kind of the top drawer recommendations that are reasonable and can be implemented fairly easily.
I think what I would add to that too. So with our toolkit, Module 5 does actually deal with. It looks at a number of climate policies. So it doesn't look at the economic arguments so much as it does look at the health evidence or the health arguments that support a number of different things like energy efficient buildings and public transit and urban sprawl, or the opposite, or compact urban design. So that's got some of the health arguments. And when you start to go into the most effective economic, you might look at other organizations like the Pembina Institute, the Ecofiscal. I'm trying to think of Green Prosperity. There's a number of really good institutes across the country that are doing some really nice analysis, but they would look at it more from an economic perspective and analyze policies more from the greenhouse gas perspective. For us, we've been kind of looking at what are the health evidence or the health arguments that support some of those climate solutions. So that'll be in Module 5 when it comes out.
Okay, so there's also another resource that's been posted by FAC, Caroline at FAC, on the chat window, so take a look at that. Now, Catherine is asking, the other question is, what do you feel are key elements in developing strategies to mobilize the population around the issue of climate change and its impact on health, with the objective of actually modifying behaviors and changing policies at all levels?
Oh, that small question. I think this is a really great question. I think one of the things, it's going to be an inadequate answer because it's a really big question, but I think one of the things I'm feeling is going on a little bit because I follow Twitter, and that sometimes the debate is around the things that individuals can do. And I think for me, what I kind of keep pulling back to is my public health background on built environment, where people can do things if we create the environment and the policies and programs that support them. So I think for me, at some level, what we want is we want to make policies support people. So if public transit's really easy and efficient, then people will use it. If it's really affordable to retrofit my homes to, that with, solar energy and, energy efficiency, then I will do it. So we need to I think we need to really look at the policies and programs and pricing system, like carbon pricing systems that are needed to really make people do the right thing. And then I really do feel like, from my experience, and I say this as, working at CAPE, I worked at coal plants, so where we really use the health arguments, but working in Toronto Public Health, I worked on a number of different issues, and I found time and time again that the health arguments really helped to win the day. And I also worked with a group, Healthy Canada by Design, which was looking at built environment issues and active transportation across the country, where you were kind of working across disciplines. And again, when public health people brought the health evidence to the table, it really helped planners and transportation planners to do they wanted to do the right thing, but they couldn't get the political support or the public support to do it. So I really feel like part of it is really bringing the health arguments to the table so people can kind of see the immediate benefits for them and their families and their neighborhoods. I think that that's really, really very powerful.
Excellent. Thanks, Kim. One more question. Does CAPE approach the issue of family planning as climate change action? How challenging or sensitive is that, and do you think it is important?
And I'm sorry, what was the opening line, Ian?
Does CAPE approach the issue of family planning as a climate change action?
You know what? CAPE doesn't have a specific, we have not addressed this issue as a board level. I know that one of our members feels quite strongly that we should, but I think, we recognize that if we can help women to become, maybe I'll just stay out of it because I feel like I don't know enough about it, but we have not weighed into the issue, but we recognize that it's an important issue, but it has to be done in the proper way. So maybe I'll just leave it at that.
Great. So I think we have another question coming in just while, okay. Carolyn has question, does CAPE have a position on fossil fuel subsidies?
I don't know if we have a formal position on fossil fuel subsidies, but we've certainly signed onto a number of letters expressing our support to phase them out. And it's part of the call to action is that we phase out fossil fuel subsidies. And certainly for us, again, it'll be in Module 5 of our new toolkit. We talk about how fossil fuel subsidies it's like, we're bringing in carbon pricing, but we still have fossil fuel subsidies. It's like, it's undermining everything we're supposed to be working towards. So absolutely, I think we see that we've got to get rid of fossil fuel subsidies. Those subsidies should be redirected towards renewable energies and just transition programs. And so there we go.
Excellent. Thanks, Kim. So we do have a couple of minutes left if you've got any more questions. As people are pondering that, I will mention to people that both CAPE and CPHA, although separately, have sought and gained intervener status in the Superior Courts of Saskatchewan and Ontario, as those provincial governments ask their Superior Courts to decide whether or not the federal government's Greenhouse Gas Pollution Pricing Act is constitutional. So we're very pleased to be able to bring public health arguments into what is a constitutional discussion at those courts. And we anticipate that no matter what the decisions in Saskatchewan and Ontario end up being, that the case will likely end up in the Supreme Court of Canada, with the exception if there's a change in government at the end of this year. I don't know if a Conservative government would be interested in staking out that constitutional territory on that particular issue, but hey, you never know. Stranger things have happened. So if you are enjoy that kind of thing, CBC will be live streaming the Ontario hearing that starts on April 15th and runs through until the 18th. It is captivating television, believe me. At least the Saskatchewan case was. So I don't see any more